serves as Care for the Aging Sisters Association Kenya. It is an association based out of the MSK, and we are taking care of aging process. It doesn't matter if you are old or not, but we are taking care of the aging processes, starting from the young sisters, the young people, all to the oldest. So that people know that all of us have a responsibility to take care of each other and we have to work together. Maybe as we wait for the next time to come, we can start with a word of prayer. If Abinata can lead us through.
Yes, Sophie. In the name of the Father, and of the Son, and of the Holy Spirit, amen. Almighty God, we thank you for the gift of today. We thank you for the gift of life you have given to each one of us. And we thank you for the presence and the time you have organized for us to be. We pray that you may give us a listening ear so that we may learn what can help us to age well together. We ask this through Christ our Lord. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. We are all welcome. Sophie,
Yes, Abinata.
continue. You had not finished what you were saying.
I was telling the participant that this is CASAK, Care for the Aging Sisters Association. And the attack is here.
Yes.
Hello, how are you?
We are fine.
Fine, thank you. How are you? Fine. Just 1 minute for we got this.
Okay.
No problem. So I was saying contact is care of the aging system of the education Kenya. We take care of the aging processes. And as we go today, we chose to talk about the aging processes and aging processes. So what you hear, what is normal? Next, when we go about the abnormal, then when you see that you're not between the normal and the abnormal, then there's something related to you. So we will come for a study of Tasmania, who is going to take us through this webinar. We are really looking forward. Let us be free to ask as many questions as we can. Since Tasmania has already told us that Dr. Tasmania is a geriatric practicing doctor who will join us with us and who works with us.
Dr. Tasmania.
And who is very important
Center.
as we continue teaching. So welcome Dr. Feel well and we check more participants as we continue. Karibu sana. Sister, you'll be able to share the slides with the participants. So I'll just be asking you to go through them because I'm on my phone. Unfortunately, my laptop has gone with my car. Oh. So I am going to be dependent on you sharing the slides with me here.
Let me accept it. Just share the slide.
Okay. See, cameras, what has happened to me?
Sophie, are you there? No, she's yeah. Yes.
Yes, that's 5%. Okay, so I think I'll just jump right into it. Look, I mean, we've done the previous one. The other one was on EEG, and as I think Sister has taken everybody through, it's important to understand what is normal as we age, so that we are able to realize what's going on and what's not. So, for the participants here, I will beg your pardon that I don't really do well with slides. I talk more, but the slides are for your guidance to follow. So I'll be using the slides. Please don't, I think sister will be able to share this slide with you for later on. It's more of a conversation that I like having, although virtually it's a little difficult. But sister, please, I'd be happy if guys can interact through the session. So should anyone need to ask something in between, I'll allow you to just, I guess, raise your hand, and sister, we can keep a check out on it if somebody has something to say or anything in between. So it's as interactive as we possibly can make it on the online thing. Although I'll try to go through the slides and then open the floor for question and answer after. Does that suffice for everybody? I hope that's good.
Yeah, that's
So
fine.
we can move to the next slide. We can move to the next slide. Okay. Alright, so just for you to understand, initially what the purpose of this, what I want you to go home with, is to understand what's going to be happening to your body, which is the physiological changes that come around with aging. What happens to our minds, so is it psychologically, emotionally, what are we going through? What the social aspect is of the normal aging process, and of course the spiritual side of things. And the point of knowing this is to be able to intervene and put into place what we consider strategies to support healthy aging, which was the first conversation we had. Again, sister, please interrupt me if I'm going too fast. And I know we are providing a course for health promoters, and also if you are interested in a caregiving space, this would be perfect to give you a guideline on what is normal, because as we are aging, there are changes that are happening where people mistake those changes for illness. And because we mistake changes for illness, we assume everything is related to old age. And that's why I want us to, separate the thought of old age is the same as being unwell, or old age comes with normal things of being sick. The purpose of this conversation is for us to clearly understand certain things are, yes, expected to happen as we grow older, and other things are not okay if they happen as we grow older. And those are things that we need to, pay attention to and seek medical advice, the correct advice as you're going along. So, as we are aging, there's a question I put in my PowerPoint. That what do you think about normal aging? And at this point, I would like to just, maybe just a quick 2 seconds to have this conversation with you and hear what you're thinking. When I just say aging, what comes to your mind? For example, prior to when I started this course or doing what I did, whenever somebody would say aging, the first thing that would come to my mind is an older person sitting in a wheelchair complaining about bone pain or joint pain. So if an older person would say I have knee pain, my initial reaction would be, oh, it's probably age-related knee pain. So I'll open the floor for 1 or 2 seconds here to see what you think. If somebody, you can raise your hand, sit there, I'll allow you to share your thoughts. I just want to see what you feel about normal aging, or what it means to you when you hear the word aging. Are there any volunteers? Or sister, do you feel like picking somebody you know for me to just give me what her thought may be on this? Yes, I want to pick Regina Vishina. Sister Regina Vishina, you can share with us.
Is Regina there?
Okay. Sister Jemima Asonga. And share with us what Tata is asking, please. Yes. Sister, yes, Nancy. You can share with us your answer, Nancy. Yes, can you hear me?
Yes.
Yes, we can. Yes, to me, this is progressive in years from childhood as I progress in years and aging. And as I witness my parents change in aging, I see it's aggressive movements. What you are able to do when you are young, they are not able to do. So sometimes we need a part of them that you could do this, you are not able to do. So to me, it's really progressive years. It's not really sickness. Thank you. Okay, so may I ask you, so if you found that one of your parents is complaining about eyesight, would you consider that normal? Or if they complain about being forgetful, would you, consider it as a normal part of aging?
No,
Yes or no?
I would prefer she check the doctor advice because even as a young person, I also complain of loss of sight, very badly. So anything connected with the pain, I would prefer them to seek medical advice.
Okay, perfect. So that will be one of the bases of the conversation today to understand that there's certain things that we do expect that come with age. Nancy, I see your hand is up. Don't talking.
Sit down.
Okay. Okay, all right. All right. Right. So let's go into what is normal aging. The definition of show something? Sure. Sally, do you want to share? Mhm. Okay, we can carry on.
Yes.
Okay. So what is normal aging? As one of the attendants had just said, it's a process of growing older. And what happens in that process is you have certain changes your body will go through that are developing over time, both on the physiological level, that's on how your body functions, both on the physical level, how your body is going to change based on what the body is going through on the physiological side, on your social side, on your mental health side, in all areas. And it's something that changes at no specific rate, and there are factors that affect it. One is your genetics, and two is your lifestyle. When we say genetics, a lot of people will be influenced in aging with the way their hereditary, genes will dictate, and our lifestyle kind of contribute to it even more so. So your genetics could be great, but you may have had a lifestyle that will hinder the aging process, which means you will age in a more severe state than you would if you had been taking care. So there's something we call normal aging versus pathological aging. What does that mean? So in normal aging, we can move to the next slide. Next slide, sister. Yes. So in the normal aging, it's the process of from time you're born. So we are aging daily. So your age in years is what the chronological aging is about. Biological aging is how your cells are aging. So what that means is every cell we have, our body cells and every organ we have has a cell that makes up the organ. Our cells have a certain lifespan in them on what they die, regenerate. Our genetic makeup dictates how many times each cell can generate itself over and over again. And there's a maximum number of times every cell in our body can regenerate. There are certain cells in our body that cannot regenerate once they die, like our nerve cells. So what happens in biological aging is depending on the number of replications your cell has and the tiny features they can no longer, grow again, causes a change to happen in your biological processes, which now will lead to the wrinkling of your skin, diminishing of your eyes, and other things that we'll discuss as we go on. So, how we age may be different. That's why we say your genetics now play a role here. So, if I've been taking care of things, that will increase the number of times my cells will die. I will decrease the number of cells that each cell will take to regenerate a new cell. So that's why, for example, as I put, a 70-year-old may be able to move better than another 70-year-old because they're probably been engaged in physical exercise, which has allowed their muscle cells not to die as fast as they would in a person who may not be so active. Let's move on. Does anybody have any question about that so far? I like interrupting just so that we are clear on this part as I move deeper into the conversation.
Doctor,
Yes.
please, I would like you just to repeat that regeneration of the cells, because you have told them about two people. You have given the comparison of two people. So please bring it out. The 70 person who is having aging differently and another one who is aging very fast.
Okay, so I will give an example again of the same thing. Let's break the 70-year-old into one cell of the body, which is the muscle cells. Okay. Now, to maintain healthy muscles, muscles need to move. So, if I take care of that one cell, it will not die fast, it will die slower. So, the amount, let's say one cell has a multiplication rate of 10 times, meaning if it dies once, it can generate 10 times in its lifespan. Okay? Now, what happens when you take care of that cell and it's taking maybe 1 year for it to die? That one cell,
You're live on
person who's
YouTube.
taking care of
You're
physical
live.
activity, maintaining good nutrition, that cell has a longer lifespan. Then it will die. So in 1 year, it may not die. Yet someone who didn't take care may have that cell die once and twice in the same year, which means it has short its lifespan. Right? And based on that is when you're able to judge that how long will that muscle take before it cannot regenerate, which will be the determinant of how the muscle will biologically age over time. So hence, in chronological age will both be the same age, but how my muscle has replicated and reached its lifespan and is determined by the things I do, which is part of the normal aging. So if I take care, I will be able to maintain cell health for a longer period before it needs to regenerate itself again. Does that clarify it for you?
Yes, I just wanted the participant to get that comparison. Thank you.
We can move on. Okay, so what are the factors that influence normal aging? Things that are not in our control. Of course, we talked about genetics. But we have families who have a very long lifespan, people who live well into their hundreds and 105s. Then there are people who have hereditary factors of disease predisposition like diabetes, blood pressure, history of cancers, the chronic illnesses that have a genetic predisposition. These things will affect how you will normally age if you are likely to get these diseases. Of course, your lifestyle factors are the most important thing, even over your genetic factors. Nutrition, physical activity, sleep, habits that we develop. The other things that will affect our aging process is environmental. When we're talking about environmental, we're looking at the connections around us. Are we able to have an environment that is in a polluted environment? That will affect our lungs aging. It will affect our ability to breathe, which will put more strain on the aging process. So any factors in your environment that are causing to put strain on your physical body will affect your aging processes. Of course, the social determinants, meaning how much do we engage, how much do we interact, how do we interact? Are we putting extra strain on our muscles that are beyond what we should without resting them enough? Are the social determinants. Then, of course, psychological and spiritual factors. This is how we balance the stresses of our life. How much time are we engaging in connecting with ourselves at the spiritual level? All these factors play a role in what your normal aging process is going to look like, for the better or the worse, depending on the positive factors and the negative factors which we discussed in the previous webinar, the healthy aging. We can move on. Okay, so let's talk about our physical changes. Now we'll go through each system. I will start with our musculoskeletal system. For those who may not know what our musculoskeletal system is, the system of muscles that are attached to our bones and our whole skeletal system. So that's our spine and our bones. What are the things that will happen to us as we age? What if we have something we call muscle loss? That is actually something that we all go through, and there is a condition called sarcopenia. Now, sarcopenia is actually not a part of our normal aging, but it still is something that happens with age because we are going to lose muscle mass. Like I explained to you, about the one cell that has a lifespan that it can regenerate in. The same thing will happen to all our muscles, like our hand muscles, our leg muscles, our back muscles, every muscle. It will eventually start losing those cells. Sarcopenia becomes a condition when we are unable to prevent that loss or reduce that loss. And when we lose muscle mass, we also lose strength. And what does this do? It will lead to us having an increased risk of falls, poor movement, poor ability to function, which is what Freud is defined as. Now we come to bone loss. What happens to our bone as we age, especially for women more than men? As you grow older, the amount of time your body can regenerate its bone. That's why, for example, when you have a fracture, why does it heal? Because new bone will form over time. But as you grow older, the formation of new bone is slower and harder. That's why fractures heal with a longer duration of time in older persons over a younger person. And bone loss is actually a normal part of aging. We are all going to lose bone at some point. So what are we going to do about it? How do we slow this process down to make our aging process better? Are the kind of things we talk about in making a difference. But it is actually very normal to have some part of bone loss at a certain age. It doesn't have to be osteoporotic where it's complete bone loss, it's just thinning of the bones. And osteoporosis is when, osteopenia in our the slides you can see is basically telling you you're at risk of bone loss. Osteoporosis is when you've actually lost the bone minerals. So you have thinner bones. So how then does that affect us in the aging process? It makes you weaker, unable to move, it affects your mobility, it causes this pain that comes around because of the risk of fractures or what we call pathological fractures. Then we have cartilage that breaks down. I know all of us will say at some point in age we're all going to have some kind of arthritis. That kind of arthritis is the osteoarthritis, which comes with the wear and tear of our joints. But at the same time, as much as these things are a normal process, they're able to be prevented or taken care of to slow them down. The joint pain, stiffness, all these things can be prevented and slowed down by movement and mobility. When we talk about mobility, our ability to move is actually a medicine. So I digress from the normal aging process as we talk because I believe it's also important for us to pick up on our previous conversation on healthy aging to involve it in this process. So we are able to, do the things right for ourselves, knowing that these are the things that will happen with the normal aging process. Any questions so far for me? Or are we going to keep going?
We keep going.
I've seen somebody's hand up.
Yes, Sister Jemima. Jemima, your hand is up. Sister Jemima, unmute yourself. Your hand is up. Are you able to communicate? Yes? That time it's like she has a problem with her network.
Okay, that's fine. So
Yes, let's continue. Yeah. Let her write.
Okay, so let's talk about the next part. How
Yeah.
cardiovascular system. What is the cardiovascular system? It is our heart and our blood vessels in a nutshell. What does it do? I mean, we all know what the function of our heart is. It's to pump blood and make sure that the rest of our body is getting the nutrients it requires, the oxygen it requires for us to function. As we are growing older, because of the age-related changes, our arteries are going to get stiffened. What is the impact of that? You have a slight increase in your blood pressure, especially the blood pressure that is recorded when our heart is in contraction, which is what we call the systolic blood pressure. Whenever we look at our blood pressure machines, most of us are aware they are two readings, something over something. As we grow older, even for the hypertension classification, you will notice it is now classified with age-related considerations. So slightly older people are expected to have a slightly higher blood pressure, because of the natural processes of our arteries losing their elasticity. So they get stiffened. They also get stiffened because of the deposition of certain, plaques, which is now the disease condition related. So what I'm trying to say is every condition we have as we grow older that we are at a higher risk for comes from a certain aspect of the normal aging. So what are we doing? Knowing that these things will happen to our body by something we have no control over, which is aging, what do we do to reduce the further risks of this being converted into an actual disease is what we are trying to do by understanding the natural aging process. So when it comes to the left side of our heart, which is what is labeled here as the left ventricular hypertrophy, we have a heart that is divided into four chambers, the atrium and the ventricles. So on the left side of the ventricle, which is the lower part of our heart, the muscle will thicken. Why? Because this part is the most active part of our bodies or of our heart. This thickens over time because of the use of that muscle and how much it's exposed. That's going to reduce in what we call the cardiac efficiency of how much blood is pumping up. So when, as an older person, we are getting the echo done, and when you get that your heart is only pumping about 40 to 45%, we don't consider that always a problem unless there's a related issue to it. For an older person, if I had what we call an ED, that is the ejection fraction, EF, of the heart to be about 45%, I would not always say that you're sick. I would consider that normal because we expect the heart muscle to thicken to reduce that efficiency. The other thing that happens.
There's somebody, please, somebody mute yourself. Please. Somebody has two meetings.
I'm on mute.
Okay, I think we're good. The other thing is our baroreceptor. Those are our receptors that are what's used to sense pressures around us. So these receptors in our body become decreased with their sensitivity. So it's not able to regulate your blood pressures the way it used to sometimes, which can.
Doctor, we've lost you. We've lost you. Doctor, we can't hear you.
I got muted by myself. I think I keep getting muted. Sorry. I think by mistake I'm getting muted. Where did you lose me? Let me start again.
There you are. Yes.
Can you hear me?
Yes.
Okay. So let's go back to the baroreceptor. Did you get me about the heart thickening?
Yes.
Okay. So the baroreceptors are the ones that sense blood pressure changes. So with age, the sensitivity.
You have been muted. Please muting.
Sister, I think somebody is muting you from your side.
I don't know who is muting you.
Sorry for that. Sorry. Okay. Can we continue? Sorry. Yes.
You have muted Daktari.
Okay, then. So the receptors are the ones that are used to, sense our pressure changes in our body. Now, what happens with age? The sensitivity of these receptors to this stimulus is reduced, which will lead to the regulation of our blood pressure on a natural process be diminished, which can lead to very low blood pressures, very high, leading to dizziness and falls. So a lot of times we find older people complaining of a lot of dizziness and things like that. Do we want to always label it as a disease condition? No. We need to go and look into, is there something going on with these receptors so that before we assume there's a disease, we're able to tie it down in the right place. Or also, in the contrary, we may assume every good person, so when they fall, we don't give it too much attention, yet there may be something pathological going on. So we want to remember why it's important to know these are changes that come around with our cardiovascular system. Next slide, please. Yes, Dr. Okay.
Ashina keeps saying in out.
Iko sawa?
I mean, I'm not saying men don't get affected by hormone changes. They do. That's what the text
Relax.
things like that. But women are far more affected by hormonal changes and endocrine changes. And when I say hormonal changes, we're looking at menopause in women. I know this is a topic that will be close to a lot of us here. And why is this important to understand? Because menopause is a natural process every woman is going to go through. But understanding it goes in phases, and sometimes the effects of menopause can affect older people, even 10 to 15 years after their menopause, because of the kind of hormonal changes and imbalance that may have happened due to the aging process. So usually women will start menopause from the age of 45 to 55, but because of our lifestyles today, we are seeing women menopause at even an early age, even sometimes starting as young as 40. And this is because of the normal change of estrogen and progesterone, which are two hormones that balance our whole period cycle. And the symptoms that would come that are normal are things like mood swings, the dryness, vaginal dryness, hot flashes. Vaginal dryness will cause itching, can cause what we call vaginosis, and lack of sleep is also hormonal related. And why this is important to understand as a normal thing is because you don't want to always go and rush for medication when you feel this. You want to look into, is this something I'm expecting to happen, and what can I do to make it better or prevent it from worsening as I go through this phase of life. Again, because of the hormonal changes, especially the decrease in our estrogen, it puts women at a higher risk of what we call bone loss, so osteoporosis and heart disease. So we want to make sure we are not adding additional risk factors to our lives when we are aging and when we are at this age. So taking care of our calcium and magnesium and bone health becomes important at this point to make this normal aging change as light and as manageable as possible, because it is going to be happening to all of us. And that's what I've talked about. Your calciums, managing with hormone replacement when required. I know a lot of us shy away from hormone replacement when it comes to menopause because we're scared of taking drugs. But it's sometimes important to understand the normal menopause symptoms. But when these same normal menopause symptoms become interfering with your daily life, you want to consider managing them before they make a lasting impact on the rest of your life, because menopause is a certain period of life which will stop at some pace. Let it not become something that affects you 20 years later by not managing it correctly while you could. Next slide, please.
Doctor, there's a question here. Let me address it.
Yes.
It is saying like this, I read. I have seen some people who use some of these skin bleaching agents, having their skins wearing out very fast, and they develop wrinkles very fast. How is this related to the aging process? Considering that some of them look more older physically than their legal age.
Okay, so I'll go back to my first slide where I was talking about the biological aging. You don't need to go back to the slide, I'll just explain it.
Okay.
When somebody is biologically aging, remember your skins also have a cell that will degenerate over time, which is what leads to the loss of elasticity. When those cells are dying, after a while, a certain cell will not be replaced, which means you've lost the cell, which means the cell causing elasticity for your skin is lost. And that's why you start forming wrinkles over time. When somebody is using bleaching agents or products in the skin that are not good for you, what is happening? You're killing those cells faster. So how is that impacting? Now, these are some of the negative factors that are progressing your aging process faster. It's kind of a kind of push to your aging process. So that's why we say what you choose to do earlier in your life will impact you as you age, because aging is inevitable. We are all going to age. So what happens? That aging process has made your cells die faster, which means your process of developing a wrinkle that you would do maybe 10 years later will start earlier. But when you're doing it, you may feel great about it, but over the time you realize it's not the best option. So it's always important to ask your doctor, seek medical opinions when you're not certain about what you're using, why you're using, whether it's bleaching products, whether it's what you're eating, whether it's what you're using for, anti-aging drips and anti-aging things, are they really going to impact you just short term, or are they doing a short term thing to make you feel good in that point, but in the longer process causing cell death to happen faster? I hope that's answered your question.
Yes.
Geriatric, you answered the question. Are you okay with that? Okay, we can move on. Now, when it comes to males, like I said, males will also undergo hormonal and endocrine changes. So there's andropause. So ladies go through menopause. For men, they go through what we call andropause. I'm sure a lot of us have never heard of this. But we believe men don't go through menopause kind of things and all. They also go through the struggles which are usually very, very not understood. Sorry, can you give me 1 minute, please? 1 moment, please. Sir? I need to take a bathroom break. 1 minute. Okay. Maybe we can now something to
Ask. I think all our participants are listening to this because this is very important. That question of artificial thing has been answered very well, and you can see how we can rush to make ourselves die very fast and we age very fast. The issue of hormonal changes are very important, and I'm bringing this to the religious men and women who are outside there. Please let us take care of this. Let us take care of this so that we are not rushing to the hospital when you are having menopause or premenopause period. We are getting to understand how the hormones move and how they reduce the energy in our bodies. So when we start having hot flashes, let us be patient, give ourselves some time so that we can regain again. Because if you rush to the hospital and it is just the normal changes of hormones in the body, very little will be done, or will be put on some drugs and not for life. So it's important that we all listen to this and it will help us. Those who are joining, you are most welcome.
any question, any clarification?
For me, I feel this is a very nice topic, so thank you so much, CASAK team. Because from the far we have gone, realize that aging is a very, very normal process.
Yes.
But it is what we all hear more. So, we are hearing something that you cannot control. But for me, I really thank you because it's making me really accept this with all its challenges, with all its difficulties. Instead of fighting with it,
Hello?
it's a time that we need to embrace it because we cannot avoid it.
I've said the link is there. Look on the link is there.
We can continue.
Yes, we can. Let's continue.
Thank you so much.
Okay, so we are talking about andropause, and why is it important to understand that males also go through these things, so we are able to support them too. A lot of times we find men are expected to not go through things the same as women, and they get sidelined, which leads to bigger problems later. Now, men will start declining in their testosterone after they are 30. So by 40, 45, you find maybe, when you find a man putting on weight suddenly or in certain parts of their body and you think, that's okay. That's sometimes not okay because it's probably coming around from the hormonal changes that they're going through. And that will lead to energy loss, problems with moods, also problems with sex drive, libido. why is this important for normal? I know for this conversation may not be relevant, but it's important for us to understand as we support people out there too. Because these are things that cause stressful situations within a family cycle or social cycle for them and lead to strain, which can then predispose them to later onset depression or dementias and things that we could have prevented if we are able to cope with the stresses that are coming in the earlier lives. Same thing with men. They also go through needing to take care of their diet, their exercise, and they may, sometimes in extreme cases, also require therapy with medication. Now, when it comes to the fact that they're using testosterone, it gives them a high risk of
15.
developing diabetes as they go. So, losing testosterone or reduced testosterone is a normal thing for aging, but wouldn't have people
I've
jumping
posted on my
into
group.
things medically, assuming something is wrong all the time. It's important to know hormone changes happen to both sexes, male and female, right? Now, when it comes to our eyes, it takes me back to my first question when I asked that do you believe me losing my eyesight is a medical condition all the time? It's a very tricky question. It can be yes and no. Because as we age, of course, the lenses of my eyes are going to degrade. I'm going to start having problems with the eyes degenerating or the cells of the eyes also degenerating, which is part of normal aging. But what do you do about it is the question. So if I have cataracts are thickening of the lens of the eye. Over time, that's going to happen. Do I just live with it and say I'm growing old? No, get it treated so that you do not lose vision. Because if you do not treat cataracts in good time and don't take care of them, they can become a point where they're not operable, and then you will lose vision completely. But just operating a cataract can restore vision for somebody and give them quality of life. So this normal aging process should be addressed to improve quality of life. When it comes to our senses, it's most of our senses that we are losing because of age or diminishing because of age should be addressed because they will impact the quality of life. Again, we start having a problem with hearing just by age. Again, we should not always assume hearing loss is age related, but we should also not assume something is really wrong with me and just to accept it. And one of the biggest challenges we have as we're growing older is hearing loss. A lot of us, as we age, when we can't hear well, we just get used to people shouting in louder tones to speak to us, and we consider that a very normal thing. That yes, everyone's going to talk to us in loud voices, and that's how we're going to deal with it. That is one of the most what would I say, life changing things we're doing for ourselves. Because the minute you lose your hearing, you are losing something that is your right as a human being. Hearing is a human right, so we say that access to hearing aids is actually a human right and it's not something reserved as a luxury. Why so? Loss of hearing is known to cause dementia. Loss of hearing is known to cause people to fall. Loss of hearing is known to cause people to get late life depression. Loss of hearing leads to people getting isolated. So, as much as we may lose hearing with age, it's important to put into place the intervention that can maintain our ability to hear. It will never be 100%, but it is better than having no hearing at all or isolating yourself because of a hearing problem.
Huh?
Taste and smell. As we're aging, we will lose our sense of certain tastes, especially salt and flavored things. One taste that we do not diminish over age is sugar. And that's why a lot of older people prefer to eat sugary foods, not because they are trying to make everybody's life difficult, because that's the one taste that they have not diminished. Smell also goes down. So these are things we want to see. How do we improve it? How do we improve our taste? Because without taste, appetite is going to reduce over time, leading to weight loss and putting us at risk of malnutrition. What do we do about it? It's where we now get the advice of trying to intervene within our day to day, how we cook, the kind of meals we cook. We try to focus on cooking aromatic foods so that when we smell them, our taste buds get activated as much as they can, or our hunger centers will get activated for us to feel like eating. When our sense of balance also gets affected by age, and that is why we say physical activity. For those who attended the healthy aging webinar, we talked about 4 areas of exercise that are very important for healthy aging. One is strength training, one is balance. Balance being very important because over time we are going to lose our ability to be balanced, and that's why you find the older person being slightly shaky because the sensations that allow us what we call proprioception is going to get diminished by cell death of the nerves. You're not able to focus or be able to tell exactly, and that's why they become unsteady. It's not dizziness, it's not vertigo, it's actually an age-related thing. How do we improve it? Working on balance exercises, working on making sure we are able to be flexible because all these things are going to improve the cell that is remaining's ability to sense these things. Next slide. I hope I'm not talking too fast for everybody.
No, you are okay, Dr.
Okay. Now we go to one of the elephants in the room, one that we don't like talking about, mental health and cognitive health. What is your mental health? It's your psychological health. It's your ability to cope with the stresses of life. And what is cognitive health? Cognitive health is what our brain will tell us that allows us to be functional. Basically, how our brain processes information to allow us to be as functional as possible. Over age, these functions will decline to a certain extent. Having said that, us having a problem with remembering certain things to a certain way where it's not interfering with life, I repeat that, where it is not interfering with our functional ability is normal. Just because you happen to forget a name once in a while, forget where you put your keys or your mobile phones, does not mean you're getting dementia, does not mean you're losing your mind. It is part of the ability to, it's part of the normal thing. But again, there are things you can do to help remember things better or do mind activities, brain activities, which keep the dementia and things at bay. Because it triggers the brain, it exercises the brain. So we say if you don't use it, you're going to lose it. And when you lose it, you're going to lose your cognitive health. You may be realizing as you grow older, maybe at some point you could be cooking in the kitchen, you could be attending a work call at the same time, you could be attending to your children at the same time and do it all fine. But as you grow older, a lot of 45-year-olds feel like I used to be able to do 10 things at a go, and now I can't. That's because you're unable to, process things so quickly to be able to, reciprocate to them. And how do you do that? You start challenging your mind. Again, when it comes to mental health conditions, as you grow older, you're at a more higher risk of anxiety, depression. Why? Because with age, people tend to isolate and get into spaces of loneliness.
They are joining.
Social isolation and loneliness are the biggest stress factors. Sorry? Are the biggest stress factors for depression and anxiety. Again, as we grow through age, one of the things that most of us will go through is either it's grief of a parent or a spouse or a sibling or even a child sometimes. And the fact that we go through grief increases our risk of becoming socially isolated over time. And with that, I think I lost myself something.
We lost your video.
Just a minute, I'm not sure what has happened.
But we can hear your voice.
Can you see now?
No, but we can hear your voice.
I
Can't see you, but we can hear your voice.
You can hear me, and I can't also see your screen, so I don't know whether I lost you. It's just a minute, I'm trying to figure out what has happened here.
Can you just check up? We had a meeting again?
Let me try and see. This is what happens with age. We don't know how to use technology. But the good thing with age is experience teaches us
Thank you.
Yeah, I think I think I'm doing well. Okay, great. Fine. So we're saying that with grief comes isolation. And because of that, we tend to be at a higher risk. So being prepared to know that at any stage we may face grief. You can never prepare for the grief that will come, but what can you do? Be aware, be self-aware, and reach out for help in good time to know that I may need help at some point or I'm not coping well. And once you reach out for help, it helps reduce your risk of developing a mental health condition because you're getting the support you require. Next slide, please. Now, why do we develop cognitive problems? There's something we call brain plasticity. It refers to your brain's ability to reorganize itself. Like I said, our cells will tend to constantly regenerate. In our brain, it forms new connections. I'll tell you a secret about human beings. We have a brain. We possibly use only 30% of that brain throughout our lives. That's why we say we are very intelligent beings, far superior to other animals, but we do not use our brain at its full potential. We reserve it. So what happens is, as we grow older and the cells are dying, remember your nerve cells do not regenerate, but your brain is able to form new connections all the time throughout your life. So that is why we say that when you do not do things to challenge your brain, you're not allowing it to form new connections. So as you age and you start doing things to challenge your mind and exercise your brain, you will start losing the ability to use that brain, which will impact your cognitive function. And I give you an example. So many of us may be in our 50s and 60s or 70s, but we just learned to use mobile phones 10 to 15 years ago. How did they learn? My mom, who's 80, has learned to use a mobile. She can take photos, she can do video calls. That's a new thing she learned. She challenged her brain. Her brain sent out new signals to other parts of her brain to learn a new skill, learn something new to do, adjust to the environmental changes she may be exposed to. Those are neuroprotective. So anything that will affect your brain plasticity will further put you at risk of more cognitive loss. And this is why we say that we must continuously engage older persons in everything and not put them aside and say you're too old to learn something. Any questions so far? Before we go into immunity and how our immunity is going to be lost as we age and how to protect ourselves.
I think we are well. We can go ahead.
Okay. Sister, please please guide me on the time. Keep the check on time.
Go ahead. We have enough time.
Okay, let's go to the next slide. So our immune system. Now you can see a big word there that's a mouthful even for me, immunosenescence. I learned how to say it after the word practice, I promised you. So don't worry about it. You can't say it.
Sister Bridget, your hand is up.
Yes, Dr. You have talked about maybe holiday, learning, and technology, something new. Do you mean to say that anybody at any age can learn something new?
Yes.
Yes, I mean that because of the fact that we have neuroplasticity that is there throughout life. So when we say, as much as with age, our brain is going to shrink, its ability to form new connections within itself is lifelong. So, for example, I will give you an example of a dementia patient. The dementia patient has lost the ability for these neural connections to make sense the way they should. Okay? That's in the simplest way I can explain dementia to somebody. But we can still start teaching them like a child how to color again. They may remember it for 5 minutes and forget what it was for, but the fact that they learned it for 5 seconds is a new skill they learned. Why? Because a new connection was formed when you're trying to teach them. What stops them from being able to remember is the fact that the neural connection is the connection with the nerves within the cell, the brain is not functioning properly because of the disease, a pathological process that has come around. But that does not inhibit them from learning a new skill again. I don't know if that answers your question.
Yes, sir.
Well answered.
Okay. So we go back to immunity. So immune senescence is basically when your immune system is slowing down and its ability to respond to infections and stresses is reduced. So what happens is when you are growing older, a simple flu can land you in a hospital with a severe infection compared to a younger person because your immune system is unable to respond as well. How do you strengthen your immune system? You see the thing about hydrating well, eating the right foods is strengthening your immune system. Again, why do we say older persons should be vaccinated for these things like the pneumonia, a flu, the COVID, for example? Why is vaccination for older people important? Vaccines will not prevent you from getting the disease. They will ensure that the disease you may get will be of less severity, which means a less likelihood of you needing a hospital admission that would be otherwise treated, easily. But your age-related factors will impact how you will, fall sick. You will be more severely ill with the same thing compared to a younger person. When we grow older, our inflammatory markers, our inflammatory processes in our body are something that change. We tend to sometimes go into a chronic state of inflammation where certain diseases will cause. Now, when you get the arthritic pains, those are all inflammations of the joints. When that happens, it's also kind of part of the normal aging, but you can diminish by now. Stress management, sleeping well, vaccines, exercise. I can't prevent you from getting osteoarthritis, but I can prevent you from letting that osteoarthritis debilitate you by strengthening what is remaining. Or going through procedures like knee replacement it's needed at the right time. Because if you wait till too late, there may not be enough bone to support it. So it's always good to keep yourself in check. Or this is normal. This crystal. Sorry? Salama. Bwana kupigia nikuulize. Okay. So it's important to keep yourself in check, knowing a normal process is happening, which is diminishing your body's ability to do things over time, slowing you down. But how do you maintain that? How do you slow it down? And those interventions are what contribute to healthy aging. Now, when we go through the social changes, before I go into the social changes, I'd like to interact with you guys for the next 5 minutes. I'm going to ask a question to the participants. How many of us
I can reach them from here.
do you engage in physical activity, and what is your idea or notion of physical activity? Anybody can volunteer to share with me, and then I want to, for those answers, I will get to the point I'm trying to drive at.
Evelyn, Fiancee, you can say something.
Let us be free to share.
Now, I want to thank Sister for all the information she's given us, and it's quite good. At a point, she asked how you feel.
Please, those who are, there are people sharing, talking. Mute yourselves. You told me you're muting.
I'm getting lost. Maybe I'll stop somewhere, then I'll join.
It's okay. That's fine. Somebody else?
Yes, can I share?
Yes.
Yes, please.
Okay, yeah. The question Gary is asking, it's very important. It talks about the physical exercise. I want to be very sincere and say, maybe recently I just started to do physical exercise, and what I do is just taking a walk. And I want to appreciate it because I'm a kind of person, a religious, whereby maybe my work is just so, it's just so set. I wake up in the morning, I go for mass driving, I go to apostolate driving, I come back home driving, I sleep. So I think physical exercise is very important. So just decided maybe when I have free time at home, you can even take a walk 25 kilometers, and I think it's very important. So I think we are not really careful as religious, we might miss this thing of physical exercise. Just wanted to encourage ourselves. Right.
So my question is, what do you consider physical exercise? If I ask you that you're engaged in physical exercise, what are you calling physical exercise?
Mary Thomas.
If you do physical exercise today, what would be sufficient for you in your mind? How would you understand that?
Okay, like the example I'm just given, I thought it's part of it. Taking a walk. Can imagine walking 5 kilometers when previously I can use a car if I'm to reach at least 5 kilometers. Yeah,
Okay. And you think that is sufficient? Would you say that you're doing enough for yourself?
Okay, maybe I need to also think of other exercise. Maybe as times.
Somebody, I'm not giving you an example, I'm not going to fail you. But I'm going to tell you what you walk on the spot. What is giving me a call? Sorry? Yes. So I want to answer her. Yes, let me answer her, then we move to the next person. So that everyone gets the point. A lot of people will do 15 minutes of walk or 20 minutes of walk every day, which is very good. But not enough is what I'm trying to say. What we also need to remember, you need to remember the walking will give you the fitness, it will give you the movement, but it will not be enough to prevent you from stiffening in your joints and maintain mobility all the time. You need to work on flexibility and balance too. So it comes back to the 4 areas when you're thinking of your exercise to know that you're involving in them. So even as you walk, ensure that you know for your age and your other physical conditions that could be limiting certain things you do. Are you doing stretches? Are you able to move in a certain way? Are you making sure your hips are covered? Because without hip mobility, you're going to lose your movement over time. But also remember, somebody with a spine problem, I don't expect them to go doing squats and trying to injure their spine more. So it's very directional, very targeted, and very individual. Yes, the next. So I've driven the point of this question home. That as much as you sometimes think you're doing something, it's better than nothing. But it's important to remember the areas of exercise that are needed for you to combat the effects of aging. And stiffening is part of normal aging, even as young as 40. So for our sedentary lifestyles, as you said, we're all used to sitting for long periods. Over time, we're going to end up with very stiff lower back and the stiff hip muscles. When your hip becomes stiff, you're going to end up with lower back pain, thinking it's a back problem and assuming that having back pain is part of the normal aging process, where it's not. It's your body signaling to you at a very young age that you need to do something, and just a bit of exercise will see the difference in your overall health, even when you're a younger person, leave alone when you get older. As you grow older, if you're able to move, you will find yourself being at a much better health status with your musculoskeletal system and overall health. The next question or person who wanted to contribute? Yes.
Tanya said what I wanted to say. It was working with the physical exercise should involve mobility and physical how to make your feet, your body, your heart, every part of the body be able to be movable. So that even if it's at the age of 60, 90, you can walk. And when we are sick, for example, if you have a spine injury, something, you have to find something that is suitable for you. But this one goes for individual level. But most of the time, we find us when we are free, we don't use our freeness, our leisure time to exercise our body parts. Sometimes we do what we think walking alone is not enough, as the doctor has said.
I would also expand a bit before we go into the social changes of aging. That simple exercises that you can do even as you stage. For example, just your the joints that are the most important are your hip joint, your neck joint, your ankles, and your wrists. Simple things like just doing what I'm doing. I don't know if you can all see. While you're even just sitting, is keeping your wrist mobile. The ability to use your hands will give you independence. The same thing I've done with my hands you can do for your ankles as you sit around. Just stretching them, flexing them, bending them backwards and forwards is very important. So same thing, you can just stand up from your desk and do hip circles. As much as the people in your office might think you lost your mind somewhere, it's okay. You just stand up and encourage everybody else to do it with you. And it becomes a thing that prevents you from sitting at your desk for 2-3 hours continuously with no movement at all. Anyone else willing to contribute, or we can move on?
There's somebody.
Okay, so let's go to the social changes in aging. Do we ever think about the changes that are happening to us as we grow older? Do we consider, for those who have families, their children growing up a transition? Do we consider retirement a transition? Do we consider the fact that we're not able to move as fast as we used to a transition? Do we ever consider not being able to enjoy the food we used to or having a reduced appetite a transition? And do we ever place focus on how that is stressing our minds? For example, somebody who loved eating food and used to, enjoy, we call them foodies. A foodie suddenly not being able to enjoy their food, do you not think that would be a place where they would be mentally strained out and wonder why something wrong? Would I never be able to enjoy my food again? How did I stop enjoying food? These are the things that we tend to forget happen as part. We assume there's a lot of assumption made in aging, and we assume that all this is just there and we can't do anything about it. How do we then understand this in the aging process? Planning is what helps. So when you're going towards retirement, how many of us here may have employers who don't look into the retirement process for their workers? Do we prepare anybody for retirement? Because with retirement, it's not about losing an income. It's also about losing your day-to-day routine. A person who wakes up every morning to go to work, suddenly is retired and wakes up with nothing to do. That can become a very stressful situation, and a person like that may decide to not want to interact anymore and sleep throughout the day. What does that lead to? A lack of activity, a lack of social engagement, a lack of using their brain. It predisposes you again to things like depression and dementia, which can change your quality of life as you grow older. When you come to loss, we prepare ourselves that at some point we're all going to lose somebody we love. And when we do, how do we cope? Are we coping? Are we asking ourselves these questions? Are we turning to our spiritual circles or our social circles to get the support we require? Are we willing to talk about it? When we look at reduced mobility, there could be an athlete who used to run every morning and that's part of his or her life, and suddenly they're not able to do that as well. Sometimes that change just makes them isolate and say, I can't do it, rather than accepting that I can still do this but a little slower. And it's okay to keep doing it even though it's slower. So being aware of this being a normal part of aging helps you prepare for it better. And the things that this thing can lead to are things that I have listed there: the loneliness, the isolation, the elder abuse. I know the question that will come around is how can life transitioning and these social changes lead to elder abuse? We are approaching the month of June, which has the 16th of June as the World Elder Abuse Awareness Day. I don't know how many of you are aware of that. But it's a massive day, it's a globally recognized day because elder abuse or older person abuse is a very prevalent thing that is often ignored and misunderstood. How does this happen when we do not understand social changes? Being left in isolation and loneliness is a form of abuse. People do not intend to leave an older person in isolation. We just assume they don't want to do things. How does that assumption come around? A person who has not addressed a hearing loss problem may suddenly just decide it's better not to talk to everyone because I can't hear what you're saying to me. I can't comprehend, so it's easier not to talk to you anymore. What do I assume? Oh, they don't like being talked to, let's leave them alone. They don't want to be left alone. We didn't identify the key problem. That is a form of abuse. That's not intentional. It's an involuntary elder abuse factor. So this is just to open your eyes. It has not an elder abuse. There will be another chapter on this. So this is just for you to open up your eyes to understand how the perception of things can change what you choose to do and how you could also engage with somebody who is already in the later stages of aging because we are all aging from the time we are born to the time we die. And the inevitable part is it is something that is dynamic and has things that are normal and abnormal at the same time. And social changes are part of a normal thing because life dynamics will change. Children will leave the house, spouses will leave or pass on, jobs will be lost, ability to do things functionally may change. And that is where teaching new skills, we should not assume or we should not disregard the role of technology in today's aging process. Technology plays a very important role in keeping us engaged with things that can help with the aging process. Like I said, an older person learning to use a mobile is massive because what that can do as an example is I'll have my grandchild come to teach me how to use my mobile, which has moved and with social engagement. Just that intergenerational gap is being filled by that 5 minutes of my grandchild spending time with me teaching me a new skill. This same thing can be spread out to schools for us to teach our children about the aging process, how to relate to it, and how that helps the normal aging process. Just food for thought as we talk about the social changes in aging. Next slide, please.
There is a question in the Tariq from Psychosocial. Which are the areas to consider when doing exercises?
Okay, it's balance, flexibility, strength training, and fitness. Fitness is the least important at this point. The other three are the foundation of aging healthy. I hope that answers.
Yes.
Thank you.
Okay. We can move to the next one.
Sister Monica wanted to say something before we continue?
Yeah.
Or Monica?
We can't hear her.
Okay, let's continue, Daktari. Maybe she can write it down.
Sure.
We continue.
So, talking about spiritual aging and inner growth. As we grow older, a lot of us have found, and I smile about this because I remember thinking when I was maybe 20 years ago, when I saw my parents, and I like sharing personal stories so that each of us can relate to this. It was maybe 15, 20 years ago. I noticed my dad, who was also a doctor, started becoming more engaged with prayers. To a point, I know we'd be like, all you do is pray all day long. Can you spend some time with us? Praying is a great thing and it's amazing. But why do you think that may have happened as he aged? He passed away at the age of 80, So I'm talking about when he turned 60, 65 days, when we started seeing him, and he was always a prayerful person, but it became more. As we age, we start looking back on life. We're going to sit and wonder, did we achieve what we wanted to? What could we have done? What can we do that we are impacting lives? Because as we're growing, when I'm 30, I'm focusing on career, I'm focusing on growth, I'm focusing on a family. Do I have time to reflect on what I'm contributing? I'm more focused within my inner space, or my external factors that require me to contribute to. But as I grow older, I am free of certain responsibilities, which then allow me psychologically, spiritually, socially to reflect on my life. What did I do? Where can I change? What can I do? So people become so much more involved in prayer, mindfulness. Suddenly, interacting with friends becomes less of a priority over maybe encouraging myself to go to a prayer meeting, for example. And if you've always been a prayerful person and you've been engaging in prayer, you may now see, how can I use this to influence the younger generation? So you start developing a deeper connection on your spirituality as you grow older. You start developing more meaning and purpose of life. You are now able to have the time, responsibility for you to focus on the things that will matter to you. Some may want to review their life, review their values that they're instilling around them. What are they leaving behind? Because as human beings, we always want to be remembered for something. I don't think anybody in this room doesn't wish to be remembered for something good they did. As we say, the good things you do will always, be forgotten, but one bad thing will never be forgotten. So how does that impact you in your later years? You will tend to be hard on yourself. You will tend to be reflecting on your mistakes and think where to go with them. But how does aging help deal with that better? Experience life and realize how much seriousness is placed on the most irrelevant thing and how priority was not given to the more important things, and you're able to do that as you age. And that's part of the spiritual aging and inner growth that comes around with the aging process. I'm yet to meet a 90-year-old who's very responsible with life unless they just feel like being like a child. And being like a child is always a good thing, in my opinion. Any questions on that?
That's good, Dr. We are getting on well.
Okay. Next. So we come back to summarizing the previous webinar in just these 4 points. What helps to make this aging process healthy? Again, I will repeat this and I repeat this and I shout it out loud from rooftops if I could. Healthy aging does not mean you are disease free. It does not mean that you have no medical conditions. It simply means you're able to age and maintain as much of your functional capacity irrespective of the factors around you. So I could still have a medical condition, but if I'm doing the right thing to make sure it's in control, it's being taken care of, I'm giving it the best chance, I am contributing to healthy aging for myself. So, physically, the factors are exercise, your nutrition, your sleep, and your ability to manage stress, because all these things will contribute to a physical decline and worsening of the aging process. So this is more of a slide that's summarizing the whole thing, because as I went through each slide, I was still talking about the things we can do to help slow down the aging process. Your cognitive function, brain skills, puzzles, reading, learning new things. Again, on the socialization, intergenerational bonding, volunteering, including older people, including yourself, not isolating yourself because you say, now I'm getting older, I cannot do the things I used to. Finding a way to include yourself in these conversations. Spiritually, being more purposeful, reflections, engaging in faith at a more deeper level. These are the things that will help this aging process be a better, more fruitful journey, because it's a journey we're all on, whether we like it or not. Next, now let's talk about how, the things that I'm mentioning here are the very common things that come with normal aging. The risk of falls increases, as we talked about earlier, with osteoporosis happening, risk of fractures. When you have a fracture, how does it come around? Because of a fall. Your eyesight being lost or being diminished puts you at risk of fall, and eyesight diminishing again is a age-related thing. When you lose your ability to hear, you're at risk of an accident. So if you still drive and you can't hear as well as you could, you may not be able to hear alarms which could, prevent you from getting into a hazardous situation. So when you're looking at your home or your environment, how do you prevent yourself from falls? You want to identify the hazards, ruts, the lighting, unstable ground, unstable steps, uneven floors. All these things are contributing to you and being at risk. Slippery floors, wet floors. What do we do? This is why we say we insist as you grow older, plan for it. Ensure having a grandma in the bathroom can help anybody. It doesn't mean just because I have a grandma, I'm old. It being there may prevent you from falling because in case you slip, you have something to hold on to. Having lights prevents you from tripping around things. Sometimes, if you know you are going to be unstable, using something as simple as a walking cane should not be looked at as a degrading thing. It should actually be used as a strengthening thing, that it is your additional support just in case. Because you never know when these things could happen. I can't stress the strength training and importance. Our muscles must be challenged every single day. The minute you stop challenging your musculoskeletal system, you will start losing muscle faster, which will make you not be able to move, which will make you, I'm sure you may have heard of some person who stands, able to stand, but feels like their legs feel like jelly. That's a loss of strength in that muscle. What helps that? Strength training keeps your muscles maintained as long as they can be for a longer period of time. Next slide, please.
That is something, say, Bridget.
Yeah.
Can you talk more about sleep? And then somebody is asking, how can I help someone who is isolating?
Okay. Can we talk about that as we finish? Then I come back to it.
Yeah.
Okay. I will go through sleep and I will come back to how to assist somebody who's in isolation.
Okay, thank you.
Okay. So when it comes to preventive measures on the immunity aspect of things, remember we talked about immunosenescence. Vaccines are highly recommended. I know we have people who are pro-vaccine and we have people who are anti-vaccine people. But vaccine in older persons really prevent them from getting admitted. Even as younger people, when we know we're going to be exposed, it helps us reduce the amount of time spent ill over the amount of time spent in recovery. Getting an influenza vaccine is once a year, and it's important to get it done, especially because we are in a country that is now prone to picking up influenza very often. So getting your annual influenza shots, getting your annual pneumonia shots, I'm not saying you're never going to get a flu. So if you go get your vaccine and get a flu, don't come and say that you said I get the vaccine and it's never going to happen. No, you will have a milder form of the disease. Because you expose your immune system to this bug, it's able to fight it. So when it comes again, even if it had diminished results, the army that is there of your white cell is able to fight it a little better because it was prepared. Compared to it being hit and then it had no clue what to do with it. Alright? Shingles, getting adult shingles is the worst thing ever. You do not want to even put yourself at risk for it because to recover from it gets harder because of age. So getting these simple vaccines is important. Hepatitis is for people who travel. These are, the WHO guided ones. But for our country, we would say getting COVID depends on if you travel, if you're going to be in crowds. The influenza is important because we are exposed to it. Multiple vaccines are important. And the hepatitis A is important because it is a food-borne entity. But trying to just reduce your risk is important. So you see, I think we're seeing a screen that is different.
Oh,
I don't know.
sorry.
No problem.
Is it okay then?
No, I'm seeing an Excel sheet.
We are having names.
Sorry, go ahead.
A different so maybe while we're doing this, I can answer the question about somebody who is isolated and how to assist him. So when somebody is in a space of isolation, you want to first find out why. Like I said, if a person has a hearing loss, hearing issue, maybe that's what's isolating them. Are they going through something that they cannot cope with, whether it's pain, that causes them to isolate? Are they physically unwell, supposing them to isolate? Are they going through depression and have they been screened? So finding the cause of that isolation one is important. Once you're able to identify a cause, sometimes the isolation just happens by virtue of not being able to cope with something in life. When you address that cause, you're able to encourage them. Simple things like trying to understand what they enjoy doing. Most of the time, when somebody is in isolation, it's mainly because maybe they can't walk well and they just don't want to go out, yet they want to interact. They can't hear. People who start having cognitive impairment tend to isolate themselves because they're so scared they'll be spoken to and they'll forget. So, gently including them, having community awareness about the patient's condition, what may be causing them to isolate, having them start with small familiar groups of people who are familiar to them, visiting them, simple phone calls, simple, coffee or tea dates, simple, I mean, if they're into Bible study and, religious practices, just going to sharing faith with them can help bring them out of this space they're in. Whoever asked that question, is there anything else you'd like me to address there? Is that answering your question, or did you have another question that made me from what I've said?
So,
Maybe just to get a clarification, when you talked about the spiritual aging, you said this desire to be isolated comes very strong. Really, they just want to be their God, to think about their lives. Now, how can that be different from the person maybe who is going through dementia, depression? There's this feeling of wanting to be alone, which is positive. But how can I differentiate it from a negative isolation? Because when you talked about spiritual aging and inner growth, this isolation can come in very strongly. Maybe that difference, the balance is where. Thank you.
Okay. So, you see, when somebody is isolating, it comes around from seeing a change in a person. So, a person who used to be very engaging and would be with you or enjoy social interactions, you suddenly feel they may be there with you, but they're very quiet, withdrawn. That may be a form of isolation. And how do you distinguish that from somebody who's just wishing to be on their own, a problem? So a social person suddenly deciding not to be engaged with the community around them or not contributing the way they would, that's one way of seeing it. In a patient who has dementia or depression, being isolated is one of the first red flags. When you see a person doing that, it's good to get screened. Um, we say you should do screening for older persons for depression and cognitive screens regularly, especially when you have a red flag. Social isolation is a red flag on its own. Whether part of the normal cycle or not, it's a red flag that needs to be addressed. Because becoming isolated, when you talk about spiritual, we're not isolating, we're taking time out, but that's not 24 hours, it's for a couple of hours a day, but we'll still be around people doing what we do. We wouldn't want to just, if you find somebody saying they're going to go into meditation for 24 hours, 7 days a week, there's something that needs to be addressed. where you understand why are they turning, even if it's for spiritual reasons, is that a normal thing to do? Is it something you would encourage continuously? Indefinitely? Yes, there are periods where you want to do that for a certain period, but not permanent. So if that goes beyond what is considered normal, it's time to now reach out, try and screen the person, try and find out. And a lot of times when it's depression related, most patients are not willing to address it. But just the simple things we talked about, letting them know they're not alone, trying to engage with them, trying to understand what may be causing it, can work a lot of ways in improving that condition or that isolation. I don't know if that answers you.
Yes.
Okay, yes, thank you.
Carrie, there's another question here. Some old people experience insomnia almost all of their old age. How can they be helped to sleep?
Yes, so I know there's somebody who asked about the sleep and us addressing it a little further. Can we address this then as well?
Yes.
Because sleep is a whole, I think sleep has a conversation of its own, but I'll cover it in brief for this, just for us to get an overview on it. So when we talk about screening, I remember I just said something about screening right now. For the regular screenings for you to do are your blood pressure, your cholesterol. How often is the question? If you're 80, I'm not going to be screening you for cholesterol all the time. Compared to when you're 60 and 50 and 40s. Why do you ask me that? Because at some point you're looking at the longer term impact of this. And is it impacting what I am going to do for you? Or is it going to give you a quality of life better? But having it checked is important for you to know what risk you're at and how you can intervene before they become an actual problem. The glucose screening also for diabetes. Your vision and hearing must be screened because you do not want to lose your ability to have a quality of life based on something that has a solution. A DEXA scan is a scan we do for bone density. It is for women who are 65 and above, you should do it every 5 years. Men should also do it, but a little less because they're at lower risk compared to women. Colonoscopy, again, males are at a higher risk. These guidelines are very standard, very overview, but these are very, especially for the DEXA and the colonoscopy, it's not necessary every 10 years. You have people who are at a higher risk, middle risk, and low risk. So the screening intervals are slightly different. And that's why you need to go for your annual check. So your doctors are guiding you based on your history, your risk factors, or your level of risks for you to be screened accordingly. Mammograms are done annually for those about 40, 45. Again, the risk indicators are what determine how often you should do it. Pap smears are usually every 3 years, and after the age of 65, based on previous pap smear reports, you do not need to do them after a certain point. Again, these are all very clinically healthcare guided or health professional guided, so that you're not just going and doing all these tests and saying, okay, I did everything, and then you have no idea why you did what you did. Even the prostate tests are something you do based on risk factors and guidelines as well. But these are screenings that we usually advocate for and say as much as we are looking into our health, it's good to just go more preventive than curative at any given point. Next slide.
Yes, Carrie?
The next slide. Is there another slide? So, as I said, I went through the bone DEXA. That these are the individual guidelines. So, for women, when you're 65 and older, or earlier for those who have risk factors, like things like family history, people who have been long-term smokers, people who have been drinking alcohol for long-term, people on steroid treatment for any reason need to be screened more often. For people who are at risk, it's every 2 years, or people who are postmenopausal initially. When you're menopausal, you do it every 2 years until you find normal results. If you have normal results, then the screening period is 3 to 5 years. And this is very guided, like I said. And the purpose of it is clear: for bone density and to prevent fractures, because you identified osteoporosis and you're taking care of it. Next clip. Again, the mammogram, we start with it. Here it says 50-74, and what we usually just do that because the prevalence of breast cancer has increased. So we say 40 onwards is a good time to start, depending again on the risk factors. Everything has a hierarchy of high risk to low risk patients and when you're going to do the screening. So for high risk, you start at 40, for the low risks, 50-74 is standard. Again, things that put you at risk is family history, contraceptive using, other history of cancers, and things like that. Next. We went through the pap smear, but I'll still go through it again. We start testing at the ages of 21 and continue till 65. Again, it's not an annual test. Previously, it used to be an annual test, but now the new guidelines suggest that you do it every 3 years. And if we say there's something called the HPV testing. When you're combining it with the HPV testing, you do it every 5 years because if the HPV is negative, then you don't always have to do the pap smear. So the frequency is as guided in the notes. For women between 21 and 29, you're going to do it every 3 years. For women between 30 and 65, every 5 years when you're doing an HPV screen as well. HPV is human papillomavirus. And then after 65, as I said, if you've had regular screenings, you can stop. Next. Colonoscopy, again, like I said, risk dependent. 45 years is when we say you should start checking with people who have a history of colorectal cancer, people with IBS or IBD, and people who may have changes in their bowel activity, bleeding in their stool, things like that. Colonoscopy is actually recommended. Every 10 years for people at average risk, every 5 years with history of polyps, bleeding, or increased risk factors. And if you find any kind of changes when you do the colonoscopy, the frequency of the colonoscopy or how routinely you should do it is determined by that. And the idea is, pick up colorectal carcinoma early because early interventions are life-changing. Next. The prostate-specific antigen, again, it has a very categorical guideline to it. So when you're at average risk, that is somebody who you think is going to be alive for 10 years or more. So if you're 90, I wouldn't do it annually for you because your life expectancy is reduced at the age of 90. But at 50 to 70 is when you do it. It's more relevant at that point in people who have average risk. High risk start at the ages of 45 to screen on the PSA. And people with a high risk are people with family history, whether direct relative or a brother or father who developed prostate problems at an early age. An African males have a higher risk for women, and they are also screened earlier at 45. Very high risk include people who have a first degree relative with a prostate cancer that was detected at an early stage. How do you screen? Average risk is every 2 years, and what the PSA level will be will determine how annually you should be screened or should you increase the screening intervals. Men with high risk is just annual and continue. If a patient at 70 has had normal screens and less than a 10-year life expectancy, you stop screening. Next. And this is just a summary of what we've said. For any screening, The intervals are very dependent on your person, so there is no one shoe size that fits all in the aging process. It's all dependent on your risk factors, on how you're doing things, what is your risk, what the risk parameters or risk uh, factors around you are. That will dictate how often you need to screen, what you need to screen, and when to screen it as well, and when to stop screening. Remember, this idea of doing tests for the rest of your life needs to stop. We need to just focus, make it very individual, very targeted. It's very important. We're not here to make everybody else rich, so to say, including myself. Now, what is ageism? I'm going to throw this back at you. I want somebody to tell me what they understand by ageism. I know we covered this in the webinar last time, but for those who may not have attended, what do we consider ageism? Anybody?
We have quite a number of people.
You choose. I allow you to choose.
Sister,
We allow you today.
Sister Pamela, Sister Pam, can you say something? Sister, yes?
Can you put in your question, please?
I'm asking, what do you understand by ageism? What is ageism? Do you know what it is? Have you ever come across the word ageism?
I'm sorry, I've never.
Okay. Anybody else?
Yeah.
Okay, that's good to know.
Sister, could you add this up?
She has just asked.
Okay.
Okay. So,
Anything? Sorry?
yeah, go on.
I answer. I was thinking about ageism being the process of aging. I am not sure it was.
Okay. No, not quite.
Can I try?
Yes.
Yes, go ahead.
I think it's the discrimination against somebody because of their age.
Yes, it is. And why does that happen? It happens because we put everything down to age-related problems, and that's why understanding a normal aging process is important, so that we are not saying everything is age-related and you're discriminating. You're too old to do something because this has happened because you're old. I lost my, I can't remember anything because I'm old. All those things are considered ageist. And ageism is basically discrimination, and it can span across all lives, and we also sometimes discriminate ourselves by saying, I can't do this because it's not age appropriate, or I'm too old for this. Is there a guideline anywhere that says you're too old for anything? I don't think so. So it's very important to break this myth of you're too old to stop. There's nothing about your age that should be a determining factor for anything that you make choices for. So one of the common things that contribute to ageism is old age equals disease. There are people as old as 101, 103 that I have, and they have no medical conditions. The only thing that they're doing is walking a little slower than they used to, or may have a slight hunched back. But that's not a disease. That's the body, degenerating with natural aging processes. When you assume that every old person is going to become senile, back in the days, senility was considered a normal thing. You'd expect every old person to be senile. I think we've heard that many times. You're senile, and that's age related. Remember what we said. Your brain's plasticity is lifelong. Your brain will constantly develop new neural connections. So when somebody is cognitively getting impaired, that is not age related, it is a disease condition. When we say older people can't change or they can't learn, that is one of the biggest problems we have. We need to change these conceptions. And again, that is why today's conversation was very, very important. To be able to differentiate what is normal from what is actually a pathological problem and addressing what is normal, preparing for it, making sure we're giving ourselves the strength and the tools to do aging correctly. So we are not going to be ageist towards ourselves. And how do we do this? Whatever we are sharing today, don't keep it to yourselves. If you see somebody being ageist, call them out, teach them, share the information, advocate for older persons, advocate for age is not a limiting factor. Advocate for saying when you grow 60 is when you start living your life. So let's all stop feeling that I'm going to grow old and I'm going to be a debilitated person one day. No, it's that it should be I'm going to grow old and I'm going to still put on my dancing shoes and go dance if I feel like. Or I'm going to still get on a bicycle and ride. I may not ride 10 kilometers, but if I do one, that's great. There is so much we can do to make ourselves to age well, and it starts with you, it starts with me, it starts with us, and the younger persons to engage with us teach the younger people how to engage with older people, so that we're not going telling an older person, oh, you're too old to do this and shunning them aside. We're saying you're too old to be included in this activity, when we are planning events for ourselves. Older persons need to be included into everything because today I am young, but I am going to be old one day. And so are you. And if you're already old, you're going to be even older one day. And I don't think any of us would like to be kept aside because we have been years in our life.
Doctor, you have 15 minutes to go.
Yes, so I want to address that question on sleep.
Yes.
Before it doesn't get addressed. So when we talk about sleep and the lack of sleep, right, it's very closely related to aging. Remember I told you the hormones and all will cause a problem with sleep. So as we're growing older, we're going to get less of what we call the deep sleep and more in the light stages. That's why older people wake up very easily. A small sound will wake them up, a small thing will wake them up, and we will end up being awake more at night or waking up several times during the night because of the kind of pattern of your sleep. Now, what happens is sometimes they'll start going to sleep very early in the evening because they get tired faster, but that means that they wake up far early in the morning, which means they're awake in the middle of the night, really. The common problems that people will get with age is either a difficulty with falling asleep or staying asleep. They may get what we call restless leg syndrome that will affect the sleep, like their legs feel uncomfortable or uncomfortable sensations that interrupts sleep. They may get what you call sleep apnea. That is basically you have a problem with breathing during your sleep and that wakes you up. Now, what are we supposed to keep an eye out on? The kind of medications we are using sometimes can contribute to sleep problems. Patients who have pain, chronic pain, things like arthritis, is a condition that affects you where you think you're in pain, but you can't find organic cause of the pain, but it's existing. Those things will contribute to your sleep being affected. When we have a problem with our melatonin, it affects, and this is the sleep hormone, it affects how you sleep and it naturally declining with age. So when you have the melatonin being deprived, you start having problems with your sleep. Now, how we encourage good sleep? Ensuring consistent sleep schedule is in place. Having your bedroom or your sleep area be dark, quiet, where it's dark. Of course, avoiding caffeine and alcohol in the evenings, especially if you can't avoid them at all, avoid them in the evenings, especially. Trying to have physical activity and not be stimulated in the evenings very much. So you don't want to do a very high intensity physical exercise in the evening because that will stimulate rather than calm you down. You want to avoid daytime naps as much as possible. And if you can't avoid it, keep them for a minimum of 20 to 30 minutes. Because some people have a routine of taking daytime naps, but that's going to disorientate them during the day. You want to minimize them to 20 to 30 minutes. And using your bed only for sleep and sleep related things rather than sitting on the bed and watching TV or sitting on your phone scrolling through, trying to go through your day on your phone. Your bed is a space for sleeping and it should be reserved for sleep only. I hope that answers your question on sleep and how it is and why is it important. Because without sleep, you're going to have a problem with your cognitive function, you're going to have a problem with your mental functioning and physical functioning. Sleep is a very, very easily ignored issue when it comes to medical conditions. And a lot of our problems come around from a lack of proper sleep, including weight gain, inability to lose weight, pain, appetite, everything is our full functionality is very important on good sleep, and we call it good sleep hygiene. So having sedatives for those of you who may feel popping a tablet or two may just give me good sleep is not ideal. Tablets like sedatives do not give you good sleep. They only sedate you. They're not sleeping pills per se. They cause sedation, which is a shut your systems. But they are not giving you natural sleep. As much as you're asleep, you're not sleeping. They're not taking you into your REM, non-REM state, the deep and light stages of sleep to have a natural sleep cycle. In fact, they're interfering with all that and putting you at a risk of further problems over the long run. So, in summary, let's remember aging is not one thing. It is focused on, or it has so many factors affecting it, like physical, emotional, social, and spiritual. It is very important to remain proactive, and I've overemphasized this throughout this conversation. And we also have to have a lot of compassion and be able to accept the things that will happen and be acceptance of it rather than being in denial about it. And everyone should be able to contribute to what we call dignified aging, because growing old is a privilege that we cannot take for granted. It is a blessing, it is a natural progression, and having dignity as we age is the biggest gift we can give ourselves as individuals, to ourselves and to the people that matter to us. So I want to say, aging is not a loss, but a natural progression that should be embraced with dignity, wisdom, and resilience. And for me, as a practitioner who is very passionate about older person and their care, it is important to make sure what we focus on is that the later years are lived with health, purpose, and grace. And we're celebrating the richness of life with every phase we go through. So I thank you for your attention and thank you for being here. And if you have about 10 minutes, I'm happy to take questions.
Yes, thank you, Dr. Yasmin. That has been very educative. Everybody is talking about a very educative session. They are very impressed. They are very happy. And anybody wants a question, please, before we move, anybody with a question?
Comments, chats. Go to chats.
Thank you very much. People are talking of thank you. They are very happy about it.
You're welcome.
Yes, please.
I predicted on the chat, I think you didn't realize. I was talking about the post-numbness.
Oh, sorry.
Sorry?
She's asking about numbness, body numbness. What is the cause and how can it be assisted?
Yeah.
Okay, when you say body numbness, are you talking about feeling a tingling sensation in your legs or feeling like you can't feel them and something is walking around? Or what exactly?
Maybe when there's, yes, go ahead. Say, explain.
We only have 5 minutes.
Maybe when she's sleeping and she wakes up, she finds the hands are numb, the fingers.
Okay, so when you're having numbness, there's something going on and you need to find out what. Numbness can be caused by a nerve problem, it can be caused by a deficiency of vitamin B or something along the line. It could be an impacted nerve, like a spinal issue that is causing nerves to be compressed somewhere. Something that needs to be addressed, needs to be physically seen, and you need to find a diagnosis of why the numbness is happening. Yes.
Thank you. Please, our participants, I hope you have registered, all of you. Please register before we leave. Any other question? Any other question?
We got it.
It's there. Names like Chema.
Yeah. Insomnia. What can we take? And what's this? That's hotness, coldness. So the sleep is not really continuous. You keep waking up and on and off. What's
So
that?
hot flashes can be because of the hormonal changes, and like I said, menopause symptoms can be there during the menopause and also after menopause for a couple of years. So if these hot flashes are interfering with your sleep cycle to a point where it's interrupting your ability to function, where you can't get sleep, endlessly, and now you're tiring and getting fatigued, it needs to be addressed medically. We need to find out why you have the hot flashes. Of course, there's a lot of ways to deal with it non-pharmacologically with certain products that we can use. But sometimes it's also good to just make sure that you're able to um, address it, at time so that you can actually, make sure you're getting some help for it and you're not assuming it's just because of normal things.
Registration ya classes zitaanza June. That is what they are asking.
Sometimes our diets are also contributing to those hormone changes.
That's good. I just want to remind the participants that Daktari told you about our training. We are starting the training, a second cohort from 9th of June. So please, those who are interested, register with us. Check on our website and register with us because everything is on the website.
I also encourage maybe your sister to get the feedback from the attendance after maybe a Google feedback.
Yes.
To see if there are any other topics through this that they would prefer or wish to engage in.
Yes.
Yes, and then we can also maybe the next topic could be based on what we feel is people's needs and what they'll be interested in.
Yes, thank you, Dr.
Yes, as you finish, thank you for everything. But maybe just to say it today and now, please guide us on the diet. What is this diet that this old people should have? What do we have to avoid? What is building their muscles better than what just on nutrition?
Okay, I can't really go into it totally deep, but what I can say in the last 2 minutes that before I get thrown out of the webinar is as we grow older, a protein diet, a rich protein diet is more relevant, but it also has to be based on patient needs. So we have to assess the nutrition. Why is the patient able to eat? Are you addressing dentition needs? Are you addressing issues like reflux disease that's preventing you from eating? What kind of foods are appropriate for different participants and staff? So it's not, I can't, maybe we can have a webinar on the nutrition and the appropriateness of it because it's a whole conversation where we need to understand Because it can't be one size fits all either. Because maybe you have a problem and then I'm telling you to eat proteins and I'm worsening your kidney problems here.
Thank you. Thank you, Daktari. Thank you. Thank you. I want to thank everybody who has attended this session, this webinar. I'm very grateful, as Daktari has said. I would like to get your feedback on any other topic that may be on the website. You send that on the website so that we can know which topics maybe you would like to have them. But we have a series of the topics coming soon. So as we continue, you'll be telling us what you want to be talked on about. Or otherwise, Dr. Rasmin, thank you so much. I want to wish you well.
And then
Just to
encourage our male counterparts to also be here.
Yes, that's yes.
Good for them too. Because even the males are aging, we're not leaving them behind, staying young forever.
That is true. And for the participants, this session was live recorded. It's on YouTube, so you can check and you look at it. Or otherwise, we want to wish you well. We want to say God's blessing to each one of you as we part. God bless each one of you.
To share that, to share. No, I don't know how I will share them because it is important that you have the slides with you. But if you have your list, but you don't have evidence, how do we get you to share the slides? Okay. But you can post this on the website and then you can have a look up from the website. Okay. Yeah. I think that will do better.
Okay, thank you.
Thank you. Bye.
Thank you.
Bye, everybody. Thank you. Good evening. Have a good evening. Thank you. Thank you, Lucy. That was good. People have had